Welcome to Champions of Care, brought to you by Oakwood Healthcare. I'm Mary Zatina. Today, we're going to be talking about a subject most people don't even want to think about, and that subject is end-of-life care. We'll be talking about all stages of end-of-life care, and you'll be learning quite a thing or two about why this is something you should be thinking about and talking about right now. My first guest in the studio is triple board certified. He's a physician who is board certified in internal medicine, also geriatrics, and also certified in palliative and hospice care. Please join me in welcoming Dr. Christopher Williams. Welcome, Dr. Williams.
Thank you, Mary. It's a pleasure to be on your show.
So glad to have you help us understand this very important topic that we don't talk about too much, and hopefully our conversation will inspire some of our viewers to talk about it a whole lot more.
Sure.
Dr. Williams, let's start very basic. What is palliative care?
Sure. Broadly speaking, palliative care is a service that helps patients and their families who are faced with a life-limiting illness. When I say life-limiting illness, I am referring to illnesses like not just cancer, but illnesses like heart failure, Alzheimer's dementia, strokes, and emphysema, which would be expected to cause not just changes in a person's lifestyle, but also in their life expectancy as well. I noticed, Mary, when you introduced palliative care, you mentioned about death and end-of-life care. I really want to emphasize that palliative care is not really about death. It's not even about end of life. It's really about life. How these patients who are faced with a life-limiting illness can live the best life possible, given the reality of their illness. And that's the essence of palliative care.
It's about life, and you use this term when people are faced with a life-limiting illness. So then how would you say, what are the goals of palliative care?
Sure. In broad terms, the goals of palliative care are to improve the quality of care and to improve the quality of life for these patients who are faced with a life-limiting illness. We also help to relieve suffering for these patients. And when I say suffering, I'm just not talking about the physical symptoms alone. I'm also talking about the psychological symptoms, and I'm also talking about the psychosocial stresses that come along with these life-limiting illnesses.
So what are the treatments that are part of what you know as palliative care?
Sure. Before I start to tell you about the treatments, let me first explain how the service is set up and structured. In most hospitals, the palliative care service is set up as a consultative interdisciplinary service. And what that means is that we draw upon the expertise of a board-certified subspecialty physician who specializes in palliative care. We draw upon the services of an advanced practice nurse who is trained in palliative care. We work with social workers who are trained to identify psychosocial distress and treat that. We also work with chaplains who are trained to really provide support and dignity for these patients. So the service is set up with experts who work together to provide that service.
And it's a team, so you're a key member of that overall team when there's a life-limiting illness.
That's correct.
Now, what does that term palliative mean? Is that a Latin word for something? We haven't heard that word a lot as consumers.
Right. Generally speaking, the word palliative means to make people feel better, and that's what we try and do. When patients are faced with a life-limiting illness, what we try and do is to do whatever is possible to help them to feel better, and that's what we try and do in palliative care.
And the psychosocial as well as the physical.
Right.
Now, help us understand the difference between palliative care and hospice care. What is hospice care?
That's a good question. I get asked this question very often, not just by patients and their families, but also by physicians in training who are working with us. Palliative care and hospice partner often to provide care for these patients who are facing a life-limiting illness. But they are structured differently and have slightly different goals. Hospice is typically a service that helps patients in the final stage of the illness, who have a life expectancy of 6 months or less. And whereas palliative care is helpful at any stage of the illness, it works alongside curative interventions and is set up as an interdisciplinary service. The hospice, on the other hand, provides service on a managed care model and helps to provide comfort and service for these patients in the final stages of the illness.
And in that case, that is indeed the final stages, the
Right.
final months of life.
Right.
But you would say palliative care should be part of the treatment plan as soon as someone knows or their physician knows there's a life-limiting illness.
That's correct.
How does someone arrange for palliative care? Do they look up palliative care in the directories of physicians, or how does that happen?
That's a good question. I would recommend that the patients talk to their family physicians or their primary attending in the hospital to see if palliative care is appropriate for them. The nurses are also trained to identify the needs for palliative care, so the patients are also welcome to talk to the nurses who can help to facilitate referrals to the service.
And if palliative care is part of my care plan, how does a patient direct the palliative care or sort of call the shots on how they want to take advantage of your skill and knowledge and expertise?
That's a beautiful question. The palliative care service is very patient-centered. So when we are consulted about a patient with a life-limiting illness, what we typically do is that we sit down and talk to you, the patient, and your family, and work out what kind of changes are going to be expected from the illness, what implications are going to be there because of the changes, and how best the patients can adapt to those changes. And what we try and do is to work out a customized treatment plan that works for the patient, so they can really direct as to what they want, what they do not want as a part of that service.
I would imagine when you're working with the family, that sometimes there are competing points of view.
Absolutely.
And how do you resolve that? You said you're very patient focused, so patient wins, their opinion prevails.
Oh, absolutely. It's always about the patient. And when we talk to families, it's always helpful to have an assigned decision maker who understands the patient's goals well, so that they're able to make what is called as a substituted judgment, that what the patient would want in that situation. So even though if we have situations where the patient is not able to talk for himself or herself, that person can talk for the patient.
You know what, Dr. Williams, we're going to talk in depth about that subject, which the fancy healthcare word is advanced directives. We're going to talk quite a bit about that coming up.
Sure.
But I want to thank you so much for all that you taught us about palliative care, what it is, how it's different from hospice care, and how we as patients can work to make sure this is part of our overall treatment as soon as we know or learn
Sure.
that we have a life-limiting illness. Thank you so much for being with us.
Mary, it's been a pleasure being on your show. Thank you.
And coming up, we will talk more about another subject involved with end-of-life decision-making, advanced directives. You'll want to know what that is and how you can make sure you have an advanced directive for yourself. Stay with us.